So step 4 in our process is something that I call the recommendations. So recommendations could be exercises, posture advice, ergonomic advice, advice on management of their injury like rest, ice, compression, elevation. It could be to do with strapping, it could be to do with bracing. The recommendations is pretty broad and I wanted to leave it like that because different physios obviously give quite different recommendations. So the main thing is your recommendation should match something you've done in the treatment or a finding that you have found in your treatment or your assessment that's going to help that person. Again, like I said in the treatment section, you don't want to give 10 recommendations because one thing that I've learnt over the years treating all of the patients I have is that people need focus and people need clarity, especially from that first assessment. So generally I'll recommend a maximum of 3 things, and if I'm giving exercises, it could be only 1 exercise or it could be 2 exercises that are focused on the main problem and one of the main asterisk signs and might duplicate some of the treatment that you've done. For instance, so if someone's got a sore knee, you found out their hamstring muscle's tight and weak, you've done some trigger pointing or massage or dry needling of the hamstring, and that's helped one of their asterisk signs, then what you're going to want to give is a hamstring exercise, like a hamstring contract type exercise. So one of the problems that we make as physios is we've done a treatment that works, but we don't give an exercise or a recommendation that matches what that treatment was. So when you're giving a recommendation, I want you to think about which treatment worked, and I want you to think about matching that recommendation to the treatment. For instance, if someone's come in and they're super sensitive, can't even touch them, you've tried a treatment, it's stirred them up, the recommendation is going to be based around painkillers, rest, use of heat or ice, whichever you feel is appropriate, positions to ease their pain. Yeah, so if a lot of stretching and movements irritated their pain, you're going to want to be very careful with giving them recommendations that involve stretching and movement, although obviously that will help their condition as time passes. But the main thing I would iterate here is make sure that the recommendations that you give follow the treatment based on what you've found has been beneficial for them. And when you communicate that with the patient, you're saying, okay, well, I'm recommending you do the hamstring exercise because we did some treatment of the hamstring and that helped your knee. So this is how you're going to be able to achieve the same thing at home. And this is how you're going to be able to help that knee continue to get better by working on that hamstring, because we found that that has an influence on the knee. Okay, so that's step 4, which is recommendations. And the way that you're going to bring it into a plan, the transition is going to look like, okay, well, the next thing we're going to talk about is what we do next.